Hey y'all, welcome to Club 07 Clear. Club's in session.
1, 2, 3, 4.
For reference, I'm Sara. I'm a certified EMDR therapist and Andrea approved consultant in training. Today I'm answering a question I get all the time in EMDR consultation. Do I really need to get a SUD of 0 and a VOC of 7? The short answer, yes. And the long answer, well, let's just dive into it. Before we start, make sure that you subscribe and hit that bell. All right, so now we're gonna dive into why it is so important that we do truly get a SUD of 0 and a VOC of 7 each and every single time that we're working with a new target. You should always strive to get a SUD of 0 and a VOC of 7 with every target every single time. I know, that's not what you wanted to hear, but let's dive into why that is so important. So first things first, I picture the SUD as the ultimate gatekeeper. If we cannot get that number down to 0, then we cannot be moving forward with reprocessing for that target. Not getting that to a 0 essentially cancels out all of those other stages, so you don't really have to worry about the VOC if we can't get that SUD down. Now remember that SUD, that subjective unit of distress, is the client's rating of disturbance when recalling that memory that we are working with. And we use that scale of 0 to 10, 0, nothing neutral, 10, the highest disturbance that you can imagine. Getting to a 0 is important because it tells us that that memory is fully integrated on an emotional level. There's no more ick in our system when we think about it. And here's the reality. The SUD, even in complex cases, should really be able to get to a 0 for the most part. We'll talk about some cases where maybe we can't, but in and large, we should be getting that number down. We should be feeling no more ick in our system when we think about a memory. And as a clinician, I really always try to get there. So even if a client tells me 1, I'm gonna ask some questions. What's standing in the way of that being a 0? Here's the thing, with new clinicians, they'll often feel like they have to complete phase 4 within 1 session. And the truth is, you don't. That is not a rule. Working with complex trauma in a 60-minute session, we know that EMDR was created for 90-minute sessions. It is so normal for that phase 4 to take more than 1 session. In fact, as a therapist that works with attachment trauma and complex trauma, I've had some cases where there's a high SUD or it's a touchstone memory, and it has taken up to 4 sessions to fully get that SUD down to a 0. That just tells us how deeply entrenched these memories are and maybe how much is connected to that memory network. Okay, clinicians, here's the meat of desensitization. Don't forget that the long, careful steps are what make EMDR work. So during phase 4, desensitization, we are literally lighting up that memory network, and then we go with that. We are going to track that memory until we get at least 2 consecutive neutral no changes or positive adaptive new information that is coming up. After that, we are going to go back to that original memory, not the image. That's a component of the memory. I see clinicians doing that. Nope, we're gonna go back to that full memory. When you go back to that memory now, what do you notice? We're gonna do it again, 2 sets until we get no change, neutral information, or positive adaptive information. Then, and only then, are we going to check the SUD. We're not gonna rush, we're not gonna chuck the SUD before that. It's not gonna give us useful information at that point. When we go back and check that SUD, if it is not a 0, I know, this is the tough part. If it's not a 0, we're gonna restart the process all over again. We're gonna do those steps again and again until we're getting it to a 0. I love the analogy that the Trauma Therapist Institute uses in their basics training. They talk about it like squeezing out the juice of a lemon. We are basically trying to get as much information out of that neural network as we can get. Right? We're trying to desensitize it as much as possible, getting it all the way out. Then we return back, and then we wring it out again, and then we check that SUD. Don't check the SUD until we've got a full jar of lemon juice. Skipping these steps or rushing this process is exactly why clinicians don't get to 0 here. I know that this can feel long, maybe even tedious for both you and the client, but we have to stay confident in this. Remember that this is how the protocol was created, and it was created that way for a reason. This is how we ensure we are getting all of the information out of that neural network. Patience, careful observation, and respect for the process are the key to making this part work. Now let's go back to Basics 101. I know some of you are saying, Sara, but sometimes we just don't get it to a 0, and you're right. That is why Dr. Shapiro created the Ecological 1. The Ecological 1 is our friend, especially if we are working with someone maybe that has experienced recent loss or grief. Maybe they're dealing with a chronic illness. Maybe this is a memory related to a parent or caregiver. These are situations where we often have trouble maybe getting that number down to a full 0. Sometimes we're not going to reach a 0 for that particular memory, and that can be okay. An Ecological 1 is a 0 for that client or for that memory. I've already told you though, I always try to get these down to 0. And working with attachment trauma, I have found that I often can get these down to 0 if we stick with the process. So when that 1 comes up, I'm going to test it. I'm going to ask some questions. I might ask, like, does this feel like a 0 to you? Like, is this 1 your 0? Or does it feel like, sure, anyone would have slight yuck that comes out for them when they think about something like this happening? Not getting a SUD down to a 0 tells us information about that client's system. There may be blocking beliefs, parts that don't feel safe letting that memory go, might be attachment dynamics at play, dissociation, or even secondary gains. This is all clinical data, not a performance metric for us, or certainly not for our client. It guides what we do next: revisiting the target, reconceptualizing, or moving into stabilization. All right, now moving to the VOC, or the validity of cognition. Quick note here is that we've spent so much time talking about that SUD, and the benefit is oftentimes when we really have done our job in desensitizing, the VOC is going to move quicker, at least in my experience. When we've thoroughly done our work with desensitizing, when we check that VOC, a client might automatically connect with it and believe that it's a full 7 without having to do really any work in this phase at all. And that's the beauty of phase 4. All that meticulous, sometimes tedious work can really pay off here in these other phases and make those phases move even quicker. The VOC measures how true this positive belief feels in the context of the memory for this client. VOC of 7 tells us that that client has internalized this new adaptive cognition and that their adult self is fully present. In EMDR, negative and positive cognitions are part of how memory networks are reorganized. When we help install an adaptive positive cognition with a trauma memory, we are not just swapping one thought for another. We're helping rewire how that memory connects to other beliefs and experiences. That is how adaptive change can generalize beyond just the target memory that we are working on. And the good news, my friends, is that if we did not fully squeeze out that lemon in phase 4, we're gonna find out in phase 5. This is not about doing sets blindly. It is about conceptualizing, observing the client system, and understanding what is blocking full integration. My friends, if your client is not getting to a full resolution, please be gentle with yourselves. It is okay. It's part of the process and part of learning. Here are some questions that you might ask yourself. What does this tell me about the client system? Is this the right target? Is there a feeder memory that's coming up that needs to be processed first? Is the adult self actually present right now? Do we need to pause and do some parts work? Are they dissociated? Do we need to do some stabilization? And this is actually where the name Club 07 Clear comes from. It is not about perfection. It's about respecting the process enough to stay curious when we don't get there. In one of my next videos, I'll really dig in and show you exactly how I flush out stuck points from phases 4 or 5 with some tools that I created. It is a deep dive that you will not want to miss. So yes, A SUD of 0, a VOC of 7, and a clear body scan matter, but not as a performance metric, as clinical information. If you're an EMDR clinician who wants to go deeper into this kind of nuance, that is exactly what Club 07 Clear is all about. I make EMDR human, relational, and I can't wait to keep learning with you. Thanks for watching, y'all.